Good afternoon, everyone. This is again Dr. Larry Kidd from Henry Mayo Newhall Hospital. We are once again tuning in to provide you with updates on the COVID-19 preparedness at our hospital. And today as well, we have Dr. Morris Yin, who is joining us. He is a pediatrician, and he happens to be the chair of our newborn and pediatrics department here at Henry Mayo Hospital. So he will be addressing some questions specific to how this virus might impact the pediatric population and some things that parents and caregivers would need to know in regards to taking care of children. Just a couple of updates. We continue to get quite a few comments from you that have tuned in regarding our preparedness for taking care of patients here at our hospital. And I'm pleased to report that we continue to have the supplies that we need in terms of caring for patients that present to us who might be carrying the virus. We are still continuing to test patients as they come into the hospital after they've had a screening. And again, just the reminder, frequently we have individuals that will call and they're requesting to be tested. And again, the first step is to have a screening, and those individuals that meet certain criteria, of course, are screened. If they are ill and require hospitalization, of course, we're prepared to take care of them in the hospital. Most individuals that report and who are in fact tested, they might have mild symptoms. Those individuals oftentimes are able to be quarantined at home and can be monitored and don't require hospitalization. We also continue to have our community respond in terms of wanting to provide support and donations to us in the way of a number of supplies and equipment, and we do have a process in place to receive that equipment. And at the end of our time today, I'll be sharing how you might be able to contact us and also to provide donations that would support our healthcare team at the hospital. So with those opening notes, I'm going to turn to Dr. Yin, who will provide an overview and provide us some insight today in terms of how COVID-19 might affect the pediatric population.
Great. Thank you, Dr. Kidd. Again, my name is Morris Yin. I'm a local pediatrician. I am also the head of pediatrics here at Henry Mayo Hospital. I wanted to start by talking a little bit about coronavirus, specifically in children. And I wanted to reassure parents that luckily coronavirus is a lot less deadly in children than in adults. To this date, there have been no deaths in children under the age of 10 worldwide. So that includes China, Italy, South Korea, Spain, and the United States. There have been a few deaths in children under the age of 18. There was a 14-year-old with pre-existing conditions in China. Recently, there was a 17-year-old in Lancaster, also with pre-existing conditions. So children can get the illness, but it is a lot less deadly. And again, under the age of 10, there have been no deaths. Children usually present a little different from adults. Their symptoms are most often mild. So most kids may not have symptoms at all, and the ones that do, usually 3 to 6 days later, they can present with influenza-like illness symptoms. So they can present with fever, they can present with sore throat, a dry cough, and usually with rest and fluids, they do very, very well. If you're concerned about your child at all, I would recommend calling your pediatrician. We're lucky we live in an area with excellent pediatricians. I admire them all. So if you are nervous that your child may have coronavirus, the first thing I would do is pick up the phone and I would call your pediatrician. Thank you.
Another question that's come in is, for example, if there is a family member that has been tested positive for the virus, how should the family quarantine are there any requirements regarding how, or recommendations, I should say, that members of the household should take, any precautions they should take?
So I think if a member of the household has positive coronavirus, you need to kind of assume that the family has coronavirus as well. So first thing you want to do is stay at home, stay quarantined, minimum 14 days. Definitely in your house, you want to wash your hands. I know it's hard, especially with kids, but even in children, you want to wash their hands pretty frequently. You want to use hand sanitizer. The other thing I would recommend is just fluids and rest. And then just watch your children. If they seem to come down with any high fever, any trouble breathing, then I would then call your pediatrician and let them know.
Just a note, we have a couple of questions regarding testing. This seems to come up at every session. The question is, do we have adequate testing kits? And again, how long is it taken to get results? And as we reported on Monday, it was taken about 5 to 7 days to receive test results back on patients. That timeline now has increased to about a week in some cases. So as more and more tests are entered into the system, is taking longer. However, the FDA has approved a faster turnaround testing process, which is being quality reviewed currently, and we expect within a couple of weeks that rapid COVID-19 test will be available. In terms of our having adequate supply and testing kits in the hospital, we do have adequate supply to test the number of individuals that are presenting on a day-to-day basis at our hospital. And again, we are waiting a number of test results, and the process is to contact individuals with their negative results. Should there be a positive result, the physician of that patient is notified to follow up with them, as well as our public health department as well. Dr. Yin, any other thoughts related to the psychological impact, or how potentially to talk with kids about this disease that's come into our society, and they might be frightened in that regard?
Right, so I think it's hard right now because children, just like adults, are mandated to stay home. They aren't able to go to school or do their normal activities, especially sports, and that's such a great outlet. Right now what I would do is I would try to find some other outlets. So at home, try to have them play some board games, do some interactive things. This is a great time to do some FaceTime and Zoom and try to reconnect with family members from far away, and even local family members. As far as speaking to your kid, I think the best thing to do is to speak to them honestly, that there is a virus going around. We need to protect the rest of the community, and our job is to stay at home and try to be as healthy as we can. If the child has any fears, anything like that, you have to let them know that right now, the family's healthy, and make sure that everyone's washing their hands and doing everything they can to keep themselves healthy, so they can keep everyone around them healthy as well.
Very good advice. Same and similar advice for those adults in the community in terms of frequent hand washing, the social distancing protocols that the public health officials have advised around are all still very much the best way to prevent the transmission of this virus. We have a few questions about ventilators. We see in the news quite frequently, a lot of the questions have to do with whether or not Henry Mayo has adequate ventilator equipment should we receive patients who require respiratory support in that way. And again, currently we do have adequate supply of that type of equipment. we're able to take care of a number of patients who might present, who need critical care level type of services, such as ventilator support. However, just with all of our other supplies and equipment, we don't know what's ahead in terms of how many patients going forward we're going to see. So we're always looking ahead to see where might we acquire additional equipment and ventilators should the level of patient volume require that. Just to start to have a wrap up here, given that we're getting close to our time today, I want to remind our viewing audience that we are accepting donations. We have individuals that have wanted to provide masks to us, other types of equipment, hand sanitizer products, that sort of thing. There is a phone number that you can reach us to inquire about donations, arrange to have those donations dropped off should you desire. That number is area code 661-200-1200. Our foundation here at Henry Mayo is available to accept those donations, and we can coordinate and arrange for the pickup of those items. On this coming Friday, we will have a special physician guest, Dr. Cecilia Hahn, who is an OBGYN on staff at our hospital, and she'll be speaking specifically to how COVID-19 might impact that population and some of the various treatment modalities and so forth regarding the OBGYN population. Dr. Yen, any last thoughts today regarding advice to our public out there regarding pediatrics?
Yeah, so the one thing I do want to add, because children have much milder cases, oftentimes they can seem healthy, and because of that, they don't want to stay at home, but they can still spread the illness. So at this time, it really is important to try to stay at home, even if your child seems perfectly healthy and happy. I think it's also wise to, again, continue to have them wash their hands frequently. Children like to, rub their noses or rub their eyes, like any of us, but even more so. So it is important to make sure that they use hand sanitizer and wash their hands frequently, especially when they go outdoors.
Yes.
So we did have a question that came in. People are saying that the virus has been here longer than we think it has been. Is this true?
I think it probably has been here longer than we think. It's hard to know without the testing, but I think it probably has.
And I would just add that scientists are continuing to study this virus and to get a better understanding. We had a question from one of the viewers as to whether or not you can contract COVID-19 more than once. And at this point, it's not exactly known. There's still a lot of analysis of the data. China is the largest data set that we have to this point. Of course, Italy has had significant cases. And so as we have more information, more data to analyze, the scientific community will be able to advise us more about the course of this virus and treatment modalities, et cetera. Researching, testing, trying to come up with vaccines and that sort of thing is still very much in the works. And at this point, we're still learning quite a bit. That will wrap it up for today. We thank our viewers for tuning in. Again, we'll be here again on this Friday, same time, and we hope today's session has been beneficial, and we thank Dr. Yen for joining us today to contribute. Thank you.